Hello, everyone. We did our psychosocial condition on post-traumatic stress disorder. My name is Mary Pfeiffer, and I covered the etiology, pathophysiology, and signs and symptoms. The etiology for PTSD is caused by a traumatic event that an individual is exposed to, witnessed, or experienced. PTSD is most commonly seen in victims who have been sexually abused, and other causes that lead to PTSD can be violent assaults, combat, motor vehicle accidents, actual or threatened death, or having a pre-existing psychiatric disorder. The pathophysiology for post-traumatic stress disorder involves the hippocampus, the amygdala, and the prefrontal cortex. The hippocampus is seen to have a lesser hippocampal volume than the average person. The hippocampus is responsible for stress regulation and memory storage, and it is also a very highly sensitive structure that does not respond favorably to continuous stress. The amygdala is a brain structure that is also involved in the regulation for fearful states and the acquisition of emotional experiences. Exaggerated amygdala activity has been observed in patients with PTSD in response to trauma-related cues and during new fearful learning. The prefrontal cortex is also affected with PTSD, and it alters the functions of the cognitive flexibility and the inhibition of amygdala hyperactivity. It has also been found that the volume of the prefrontal cortex is reduced in patients with this psychosocial condition. Patients with PTSD have also displayed abnormal pathways between the amygdala and the anterior cingulate cortex. This abnormality suggests a change in the ability to control fearful states and behavioral flexibility.
And pause it again.
The signs and symptoms of PTSD are intrusive and distressing memories of an event, flashbacks that could last seconds or several days, and the individual acts as if that event was occurring in that moment. Avoidance of stimuli connected to the event, persistently negative emotional states, feelings of detachment from others, irritability, proneness to outbursts, exaggerated startle response or jumpy, and for PTSD to be diagnosed, these signs and symptoms must occur for at least 1 month.
Hi, my name's Addie, and I'm going to be covering prognosis and clinical course. So for the prognosis, this ultimately relies on the individuality of the patient. So I found a journal article that did a study in 2013 with veterans and the varied mental health conditions that they had. And in it, I found that with patients with PTSD, that the older the patient, higher economic standing, and the higher family involvement, the lower mortality rate that they had with those individuals with PTSD. But on the opposite side, if they were younger individuals with lower economic standing and less family involvement, the higher the mortality rate with patients with PTSD. Next, I had clinical course. So the clinical course of PTSD also depends on the individuality of the patient. So depending on when they receive help. For psychotic symptoms could be manifested several months, sometimes even several years after this traumatic experience with the individual. So in treating these events, patients with PTSD will take antipsychotics. By taking these, it shows it can help lessen symptoms in patients with PTSD who show resistance to taking antidepressant drugs.
Hi, my name is Donna Jean, and I'll be going over general treatment, occupational therapy role, and community resources. For general treatment, there are two types of treatments. There's evidence-based treatment and evidence-based pharmacological treatments. These evidence-based treatments are the most supported treatment options, and they include psychosocial interventions, which are where the therapist helps the patient use a systematic approach to rather than avoid the safe but feared stimuli. Then there's cognitive-based theories, which have a goal of producing changes in negative thinking patterns. Then there's eye movement desensitization and reprocessing, which consists of visualizing a past memory and focusing on bilateral eye movements. Finally, there's relaxation-based psychotherapies, which is a type of treatment that focuses on skills training and anxiety management, such as breathing retraining, muscle relaxation, and negative thought stopping. For pharmacological treatments, there are selective serotonin reuptake inhibitors and other agents such as trazodone, which is an antidepressant, and prazosin, which helps with sleep disruptions and nightmares. These agents have not been FDA approved but have been proven to be very promising in reducing PTSD symptoms. Okay, next is occupational therapy role. Individuals with PTSD can experience many disruptions that can affect their daily occupations, such as self-care, sleep, social integration, productivity, and leisure participation. An occupational therapist can help improve occupational performance and promote health and wellness by utilizing meaningful occupations. Treatment will differ based on the needs of the client, but can include self-reflection techniques, creative expression activities, life skills courses, integrating family systems for support, building routines, and relaxation and breathing exercises. The main goal of these treatments is to use meaningful activities as an opportunity to encourage independence, self-worth, accomplishment, and well-being for each patient. Next is community resources. There are many options such as counseling, which is helpful for locating psychologists, social workers, treatment programs, support groups, and advocacy organizations. There are transportation services available to help you get to and from appointments, and they also offer general transportation needs as well. And lastly, there are general wellness classes that will teach you how to engage in activities and behaviors that promote health and wellness. And here are our resources. Thank you everyone for listening to our presentation on PTSD.